Let's get to Dr. Chris Labos to talk about the story, the terrible situation, that mass killing in Uvalde, Texas. You know, a lot has been focused on the children, obviously, who were killed there, and two teachers were killed as well. And one of them, her husband, only a day later, ended up dying as a result of all this. And a
Yeah.
lot of people describe that as him having died of a broken heart. He lost his wife in this tragic, tragic shooting. So, Dr. Labos, we figure you're a cardiologist. Maybe you'd be the guy to talk to, because this is not the first time we've heard the term, dying of a broken heart. And typically, it doesn't actually involve dying. But I'm just curious if, in fact, there is such a thing. Have you ever heard of this before?
Yes, I have. So there is a condition called stress-induced cardiomyopathy, cardiomyopathy meaning heart failure, essentially. So there is a condition where extreme emotional stress, either caused by personal grief or the loss of a loved one, or often somebody who's caught in a natural disaster, earthquake, fire, something of that kind, they can develop heart failure. Now, this isn't a heart attack. A heart attack is when you have a blocked artery in your heart that, blocks the flow of blood to the heart muscle, and the heart muscle dies and it forms a scar. This is something completely different, where the surge of stress hormones, of catecholamines, because of the situation that you're in, can actually cause the heart to dilate and get large and essentially put you into heart failure. And that can then put you at risk for having arrhythmias, which is, what would presumably kill somebody in that type of situation. So there's a very specific name for it. It's actually known in the textbooks as Takotsubo cardiomyopathy because it was first described in Japan. And when you look at the heart on imaging studies, it looks like a traditional Japanese octopus pot, and that's where the name Takotsubo comes from.
And if that's the case and that happens, is that kind of, I was going to say, is it reversible? Can it be treated, or is it just too late if you're suffering from that?
No, it actually is treatable, and it often is reversible. The prognosis with this, despite the name, is actually quite good. And most people do have some recovery, and some people have complete recovery. So, if you can identify the cases and start treatment, there's every reason to expect that the person would make a full recovery. The difficult question comes: let's say the heart has returned to normal. You're never entirely sure if it's safe to actually stop the medications at that point. And there's always this worry that if you were to stop the medications, could the heart then fail again? And so there's always a very difficult conversation to have with the patient about: do you leave them on the medications lifelong, or do you try to get them off of it? And I think most people are of the opinion that if the patient's feeling well and the medications are not bothering them, probably best to stick with the medications going forward, just for preventative measures.
Dr. Labos, you touched on the role of stress and grief. I'm wondering about mental health in general. How huge a role does mental health play here in terms of the duress on your heart?
So it plays a role, and when you look at people who have pre-existing mental health problems, especially depression, they are at increased risk for heart disease. Now, the question has always become, is it because of something medical that's going on inside the body? And there's been some suggestion that because disruption of serotonin, it can make your blood clot more. And there is something to that. But the other factor that tends to complicate any type of analysis here is that we know that people with mental health problems tend to smoke more. They, to a certain extent, exercise a little bit less, to a certain extent, have diets that are less healthy. So it's very hard to tease out, is it the mental illness itself that is somehow putting these people at higher risk because of the biochemistry of it, or is it the associated lifestyle factors that are the ones that are influencing heart disease risk? But that's more for your risk of developing a heart attack, a blocked artery in the heart, not necessarily for Takotsubo cardiomyopathy, where when that happens, the arteries of the heart are usually clean.
There's a lot to this, huh?
There is. And just one last question here. If you think, like, if you're in that kind of situation and you're feeling like you might be suffering a heart attack or something might be happening, you just call 911. Can you? It sounds silly, but like take deep breaths and try and calm yourself down. Any advice for in the immediate moment, Dr. Labos?
If you think you're having a heart attack, the best thing you could do is call 911.
Okay.
Most people think that, everyone at the hospital thinks, people shouldn't show up. If anything, if you speak to most cardiologists, and especially if you speak to the cardiologists who do angiographies, who unblock people's arteries, they will almost universally tell you that the big problem is that people don't show up to the hospital quickly enough. If you think you're having a heart attack, meaning a blocked artery, the faster you can get to the hospital, the faster you can unblock the arteries, the better off you're going to be. And the mistake that most people make is that they wait too long before showing up to the hospital, not the other way around.
Okay.
Dr. Labos, thank you so much. Appreciate you weighing in on this and clarifying it for us. Thank you.
My pleasure. You take care.